Dr. Amanda from StraightSmile Solutions, and today we're going to be talking a little bit about anodontia or hypodontia, or basically missing permanent teeth. And I know in the past we've talked a lot about missing lateral incisors, peg lateral incisors, but I'm here to show you a panoramic x-ray today, and this panoramic x-ray has it all. And I love reading x-rays, so I'm going to tell you a little bit about what I see, narrate you through it, but really my goal is to tell you a little bit about missing premolars. And down here you can see this. There is a permanent tooth that is missing. So look at the adjacent side, or the contralateral side. See how you see the tooth bud right there? This one is missing. And actually the incidence of this happening in the human population is relatively high. It's about, I think, 0.5 of 1%. So if I'm doing my math right, that's 1 out of every 200 people is missing one or more of these teeth. And it runs in families. It's genetic, and it's not a terrible thing. Matter of fact, it runs in my family. I'm not missing one, but I have other close family members who are. And it's often closely tied to other traits like peg laterals. There's one right there. And missing lateral incisors, which we also have in this case too. So all sorts of stuff coming on. So things for you to know if you're going in for, first of all, it's really important that dentists are screening for these things. I like to take panos as early as age 7 in patients, just so we're kind of screening for anything. All sorts of things you can find in a panoramic x-ray. It's kind of like a crystal ball. You like to predict into the future what is going on, and give the parents some idea of what they can expect. If you're missing a tooth, not a huge deal, but it's good to know that you're not expecting that baby tooth to fall out. So if you don't have a baby tooth under there, then you can't expect this tooth to be pushing that tooth out, right? It's not going to cause the cascade of events that causes resorption and the enzymatic resorption of these roots. It doesn't mean that they can't start resorbing on their own. Look here, this one's already resorbing. This one's not so much. But we want this tooth to hang on as long as possible in most cases. Now, there's a few one-offs. If a patient has a ton of crowding and they didn't address it earlier in phase 1, they didn't do arch expansion and arch development, then maybe you will have that tooth pulled and they can use that space up for the crowding. But in a healthy child where you've addressed things early like you should, you're probably going to leave that tooth. Why? You're going to leave that tooth, and maybe you will bypass it with the braces or the aligners so that it doesn't get jiggled and joggled around, and hopefully that won't help trigger any more resorption, but it's still a perfectly great tooth. That means, of course, you got to prevent cavity from cavity and wear and all sorts of other things, and anything that would cause the roots to resorb. So it may hang on there 10, 20, 30, 40, 50, 60, or even a lifetime amount of years, and nobody cares. Couple of the little things that can happen though, it is a slightly bigger tooth than the one that's coming up on the other side, so it can cause the bite to be a little bit off. The midlines can be a little bit off. A couple just little minor, you're talking a couple millimeters, not a huge deal. Sometimes, not a huge deal. But another reason you want to maintain it is if you are, let it hang in as long as possible, because that holds the bone in most cases, unless there's a problem with the bone development, so that later when you need to get an implant, you've already got the bone there. It's really healthy bone. It's high bone, and you don't have to get a graft. So anyways, wow, that was a lot of information. But basically, the goal was to talk about missing premolars and what to do and things to talk to your dentist about. And hopefully your dentist is screening for these as young as age 7, finding them and making a plan. Dentists out there, you need to visit StraightSmileSolutions.com. We're here for you. We're going to help walk you through your orthodontic cases, help teach you a little bit more about how to screen cases. If you're looking to launch or accelerate orthodontics in your office, this is the place to go, StraightSmileSolutions.com. All right, thanks so much and have a great day.